Thanks very much, Pam, and lovely to be with you on a Saturday afternoon. So I'm going to talk to you about the care partner policy. So I'm going to cover off why we're doing it. So we are doing this because we want to share with you our work so far on this care partner policy, and we're in this engagement process at the moment. So we're talking with patient groups, patient reps, NHS and social care organisations, professional networks, voluntary sector and community sector organisations. I'm going to be taking some notes as I sort of answer questions from you, which will sort of be recorded as feedback. We'll share the slides afterwards. If you've got anything that comes up after the session that you want to send to me, my email address will be at the end, so you can send those over, and I'll kind of summarise back the meeting to Pam, so she can just share with you what I think the key points were that we talked about during the session. So why do we need a health and care partner policy? So the NHS is committed to providing high quality care that's safe, effective and person-centred. We want to build a culture that supports patient and family partnerships. We've done lots and lots of work around improving experiences of care, but we do know, as most people who work in healthcare and social care, that the COVID pandemic brought many challenges. It caused people to be restricted from hospitals and care homes and other places. And this policy is about sort of building on national visiting policies, supporting friends and family to be involved in their relatives' care, and trying to break down some of those barriers that have been created through the restrictions that were in place in the pandemic. So the strategic context is that we know that if people who are important to the person receiving care are involved in the care, it improves the quality of care, it improves the person's well-being, it leads to improved patient safety, outcomes and experiences. And supporting patients to be actively involved in their own care, treatment and support also has an impact on efficiency and benefits for the healthcare system. So after taking a personal patient story to the NHS England Quality Board, which is made up of all the chief officers of NHS England, including the chief nursing officer and chief medical officer and others, they wanted us to work on something that would help people be a partner in care. So in 2022, we set up a Health and Care Partner Advisory Board, which was made up of clinicians, nurses with various different backgrounds, from maternity through to end of life, covering things like learning, disability, autism, the panoply of all the different kinds of care that we give, including social care. Lived experience partners were part of the group, and two of the key stakeholders were John's Campaign and the Patients Association. So that advisory board has overseen this work, and we worked with 12 pilot sites that were acute pilot sites, who co-produced with patients, staff and carers versions of a care partner policy. There were 12 sites, 2 of them have implemented their policies. There's about 6 of them who are about to sort of implement, and then the others are still part way through the work. But it's been very much a partnership, and it's been part of co-production. The strategic context is the NHS Constitution sets out a number of things that relate to care partners. The patient will be at the heart of everything the NHS does, supporting individuals to manage and promote their own health. And also the patient safety strategy talks a lot about how patients and families and carers can support safety aspects. So why care partners important? It's about focusing care in a way that kind of supports the person to have support and informed choice. We know that family involvement can improve patient outcomes and experience and help with communication and shared decision making. And we've also worked with a couple of international sites who've established this care partner programme. Canada have done lots and lots of work around this, and they've been heavily involved in our thinking around this, as well as a care partner policy that was implemented in Northern Ireland during the pandemic. Family members and people important to the patient are encouraged to be part of the quality and the safety monitors as well. And we know that family involvement contributes to safer environments, and having care partners as allies in safety and infection control can help too. And part of the programme will also be to sort of educate care partners and encourage them to escalate any worries and concerns if they notice any change in a patient's condition or concerns about their health. And you're probably aware there's been quite a lot in the press at the moment about a young girl called Martha who died of sepsis, and some work that's called Martha's Rule around this. So we know that care partners will be integral to that. So a definition of a care partner is someone who is doing a practical role, providing additional support to the person receiving the care, regardless of the care setting. Care partners can include family members, close friends. They provide physical, psychological, emotional support, but it's all based on what's important to the person receiving care. So we often talk about what matters to you. This kind of flips it and says what and who matters to you, what's important to you, and who is the person who's most important to you. The care can include providing support in decision making, care coordination, and help with continuity of care. Care partners can be with the person receiving care as and when required, any time of the day or night, to provide the support needed based on the needs and wishes of the person. So it's all about person and family centred care, wrapping the care and the support around what the person receiving the care needs and wishes. Care partners are complementary to the role of carers, can extend beyond paid or unpaid carers. They can be family members or friends. And if sadly someone ends up in a position where there's some kind of trauma, emergency surgery, or accident, they can nominate whoever it is who's most important to them to be with them at that point in time. So the guiding principles around care partners, which were co-produced through the advisory board and the 12 pilot sites, is that it's about differentiating between visitors and the person who's most important to the person receiving care and their care partners. So for a hospital stay, you may still have visitors, you may have your friend from the book club, your neighbour come and visit you, and they would be bound by the kind of visiting policies in place. But if you are frightened of something or need some support or help, you can nominate your partner in care and they can be with you whenever needed. So it's about recognising the value of the individual who's most important to the person receiving care as their care partner, making sure that the person receiving care, families, care partners are also part of the co-design. So that's been very important in the work that we've been doing. And care partners are complementary to the care delivered by staff. In no way do we expect partners in care to replace the care that would be delivered by staff. It is about being a partner in that care. And the important thing is that the policy will be applicable in primary, secondary, tertiary, social care, including outpatient appointments. So from your perspective as dental nurses, this will be applicable in primary care, in the sort of dental setting. If somebody needs someone to be with them, the care partner policy would apply, as well as in secondary, GPs, tertiary, social care, and outpatient appointments. So there are some questions that we're not necessarily going to go through today. As I say, I'll PDF the presentation and you can have a little think and look through. Open it up to questions, a few little things just to kind of hear about that are not on the slides. We've done the health equality impact assessment, and that has kind of forced us to think about inclusion health groups. So how would this policy apply for people in prison who need to come to hospital for an episode of care? How do we make sure that people who are homeless have the opportunity to have a partner in care? Lots of conversations around the Mental Capacity Act. Sorry about that. Lasting power of attorney, all the kind of legal and statutory obligations. And one of the other things that we've been doing is the two sites, which is Barnsley and Lincoln, who've actually got a policy and are putting it into practice. We're doing some work with them around leadership, culture and learning, because we know having a policy isn't going to make this happen. What makes a policy happen is clear leadership, a culture that kind of embraces person and family-centred care and learning from that process. And there's also some considerations we need to make around sort of coercive relationships and making sure that people are not forced into having a care partner because there is a coercive relationship. So apologies for keep coughing, but I've got a little frog in my throat. And happy to answer any questions, take any comments. Tell me what you think.